Okay, let's see the lecture note for week 4. Okay, we'll continue the future smart connected communities to fight the COVID-19 outbreak. Continue to study this paper. Okay, let's move to section 5. Okay, future smart connected ecosystem and technology solutions. They propose IoT use case scenarios by deploying novel smart device, data-driven applications, and technologies to present a holistic view of IoT-enabled smart architecture for fighting COVID-19 outbreak. They divide their scenarios into 5 categories. Okay. First, e-health. Next, smart home. Next, smart supply chain. And smart locality, smart city. Let's first see the e-health. The global internet medical things, abbreviation is IOMT. IOMT market will be expected to grow to 136 billion in 2022. As of 2020, 3.7 million medical devices are in use today. Which monitors patient conditions, which has function to send the data to hospital practitioners in real time. E-health helps to mitigate fast-spreading COVID-19 that has taken over the entire healthcare ecosystem, including hospitals, testing booths, vaccine developing labs, pharmaceutical companies, health insurers. A data-driven applications such as ML for drug discovery, remote patient monitoring, predictive analytics for hospital resource optimization, and interactive medicine deliver the right information at right time in healthcare system. Improving the health efficiency of healthcare service and keeping healthcare costs under control have been important critical challenges during the COVID-19 pandemic time. To overcome these limitations, they discuss three important application scenarios: smart hospital, remote patient monitoring, smart testing views, shown in figure 3. Okay. Figure 3 shows conceptual overview of connected smart e-health ecosystem. Yeah. The system includes hospital room, okay, hospital room. Here is COVID-19 patient in hospital. The patient has many equipped with many sensors. Okay. Temperature, microphone, okay, glucose sensor, oxygen level, heartbeat sensor, insulin pump. Insulin pump is actually actuator. Remotely control the insulin pump. Okay. Drug delivery, remotely control the delivery of drug. Okay. And smart device, global sensor. Okay. The hospital practitioner. Okay. Yeah. Using IoT applications, can monitor. All the sensor information of the patient. Okay. So every data, okay, connected to centralized cloud. Okay. Centralized cloud. Okay. The smart ambulance and the smart parking can send this is bidirectional two-way communication. Yeah. This is smart parking. Also two-way communication with the cloud, centralized cloud. Okay. Let's see the home. The patient stay at home. The remote patient monitoring works, and the home gateway send data to cloud and receive data from cloud. Okay. The patient staying at home use mask sensor, glucose sensor, smart device, temperature sensor, microphone, oxygen level sensor, RFID sensor. Okay. And all the information through the sensors can be sent to centralized cloud. Smart pharmacy. The pharmacy practitioner use IoT applications. Also, the COVID-19 patient in the smart car can take medicine. Okay. While they ride on the car. Okay. They communicate. Yeah. To the cloud. Smart testing booths. Okay. The patient not visiting hospital, they can test their condition. Just in the smart booth, testing booth. Smart testing booth can sense mask, can have mask sensors, smart device, global sensors, oxygen level sensors, okay, temperature sensors. Smart hospital also healthcare supply, medicine service, ventilator service, laundry service. Okay. Okay, this is an overview of smart e-health ecosystem. Okay, let's move to smart hospital. Okay, today, smart hospitals are still facing several challenges, including shortage of materials, okay, equipment, and the patient room, more especially ventilator, thermometers, disinfectant, cleaning supply, including hospital practitioners' shortage in responding to COVID-19 pandemic. and nurse shortage. To overcome these problems, they propose a smart hospital use case scenario that employ IoT technology to extend the existing infrastructure to enable coordinated action for COVID patients. Okay. There have been works to show various components of smart hospital concepts. Okay, within a smart hospital, the RFID sensors can be an ideal way to keep track of PPE, cleaning supplies, medical supplies, smart bed, ventilators. Okay, this is track RFID sensors. Okay, RFID, you can imagine barcode in the market. Okay, certain item has a barcode, then the item can be monitored. One can track the item. Same idea, RFID sensor. While RFID sensor is used to track the location of materials, patients within the hospital. Other IoT sensors, along with the technology including AI, big data analytics, blockchain, can provide multiple benefits to patients and facilities. More specifically, hospital practitioners, staff members, patients can wear smart bracelets. For example, I had a smartwatch or smart rings to capture early symptoms of COVID-19. By collecting their data, including body temperature, heart rate, blood oxygen level, and store at each data centers, which avoid the latency and the security issues. Okay, anyway, now we skip this idea. This model will increase the intelligence of data-assisted applications that can be used to predict early symptoms of COVID-19 infection for hospital practitioners and staff members. Using IoT sensors and the wearable device, Hospital practitioners can not only collect usable data with a minimum in-person contact, okay, collect usable data, but can also reduce risk of cross-infection from the patient. Typically, due to limited storage on the edge, okay, this is the storage in the computer in hospital. Yeah. Due to limited storage, local storage, limited local storage, data can be sent to centralized cloud through secure data channel, tunnel. Yeah, tunnel is channel, is the same. Secure tunnel means secure channel. This tunnel is encrypted link between edge device or gateway and centralized cloud. Okay, the paper reference 30 can be replaced with a simple adoption of an encryption scheme to enhance the privacy of IOMT data and support multiple clients. The connected device can communicate, operate automatically, autonomously. For example, smart ventilators can communicate through a patient smart bracelet with embedded sensors, can respond according to patient's body parameters. Health practitioners can also monitor patients, take decision based on a combination of IOMT and augmented reality technology. Augmented reality technology can provide additional benefit. For example, breathing exercise for the patient. Autonomous robot can also help in healthcare system as a virtual clinic, smart card, provide food service. Similarly, smart cameras can be employed for continuous monitoring of patients, including hospital inventory, hospital resources, peak hours. An autonomous mobile ultraviolet C UVD disinfection robot can disinfect rooms equipment with ultraviolet light and hydrogen peroxide vapor, and will travel in hospital using a random pass planning algorithm to disinfect areas swiftly. Let's move to remote patient monitoring, RPM. RPM allows health practitioners to monitor COVID-19 patients remotely and provide care for recovering patients at home. Most popular companies such as Giant, Cognizance Medical, Igenta, iHealth can enable RPM and provide a platform for physicians and hospitals to monitor patients outside of the hospital setting, where the technology can provide data communication between patient and health practitioners. Patient-generated health data, this is PGHD, including body temperature, oxygen percentage, breath, pulse level, pulse rate, coughing frequency, ECG can be collected using wearable device together with the internet-enabled medical device. This data will be sent to web server through message queuing telemetry support protocol or HTTP, where it will be stored securely in patient private cloud or specific medical cloud. Patient-generated health data can be retrieved for analysis by hospital practitioners, enabling early detection of COVID-19 and identifying critical conditions of patients using MLTL algorithm. For example, if SpO2 level of patient is less than 85%, the hospital practitioners will receive alert through data-driven application and then send the extra care service to patient. The patient can also receive inbuilt corrective recommendations regarding medicines, extra precaution to be taken at home through IoT applications. Okay. Patients can also add his or her family members or friends to share the patient's PGHD with a different level of access control due to security and privacy concerns. In general, due to privacy concerns, a patient might not agree to share his or her data in such case. Health device will send data on a gateway device. This can be patient's smartphone. Patient can also receive alert based on threshold values through applications, especially when the patient's health condition is critical. However, some alert can be false positives, and to address such errors, then sense network along with the medical device can help to reduce false positives. Furthermore, classification technique such as hidden Markov model can be also used to classify anomalies in PGHD. This idea is to detect false alerts. So the cloud or gateway can detect the false positives. Okay, let's see the smart testing booths. Boston Hospital developed innovative coronavirus testing booths to keep healthcare workers safe, while swabbing possibly infected patient and conserve PPEs. A smart testing booth can include multiple sensors like infrared large-scale body temperature sensor, no contact oxygen level sensors with a red, green, blue camera, RFID scanners, and the AI-assisted smart cameras. A single person at a time can enter one side of the glass world testing booth and will be identified through RFID tag based on wearable device or optimized face recognition algorithm. Each identify the patient. Inbuilt sensors in the booth can record a person's body temperature, oxygen level, including PGHD, other PGHD, which will be stored in the medical cloud. An individual can receive the result of COVID-19 test through a phone application and set an alert on his wearable device for the test result. Okay, some other IoT applications and service in the context of e-health hours discussed this paper. Smart ambulance can provide virtual onboard assistance to help patient and find the optimal path using ML service to hospital in case of emergency. Hospital smart parking system can scan license plate or drivers to identify COVID-19 patient using the patient's data, and can also assign special spot of park his car. However, the patient's personal data can be stored on multiple storages to avoid centralization, which cloud lead to hacking, which could lead to hacking, loss, mishandling of patient data due to centralization. Blockchain technology can be used to secure patient personal data and deliver decentralized attack detection model to mitigate the single point of failure. This is concept of distributed database of the blockchain. In the above scenario, data and the information collected from smart device are sent to edge gateway, service, or cloud. Due to high security and privacy concerns in health domain, it is important to understand that these edge gateways and the cloud IoT platforms will be owned only by authorized entities, such as hospitals or other highly trusted entities through some private cloud. They address this issue in section 7. Okay. Smart home. Today, smart homes make our lives easier, provide convenience in our daily activities, from automatically tuning on thermostat from smartphone to opening the smart garage door remotely. However, we can also utilize the smart device to keep our homes healthy, sanitized. In real world, it is nearly impossible to keep everything around you virus or germs free. However, individuals must employ precautionary measures to keep their homes clean, disinfected. In order to prevent the spread of COVID-19, first step is to sanitize our homes. Currently, smart light, temperature control with their compatible sensors have become ubiquitous in smart home environment, enabled by wireless sensor networks. According to Global Tech Market Advisory Forum, voice control device based on orders, shipment will grow globally close to 30% over 2019. Using voice control allows people to avoid touching. Commonly touched surface around the home, such as smartphones, TV remotes, light switches, thermostat, door handles, and others. So the smart homes, which can offer a more connected ecosystem to mitigate contagious disease spread. Figure 4 shows the smart home. This shows the figure of connected smart home environment. Okay. Actually, this is COVID-19 patient who stay alone in home. So we can, this one is stay with the family members. Okay. The COVID-19 patient can stay in the fixed room for COVID-19 patient. This is COVID-19 patient room, dedicated room, equipped with many sensors. Okay. And this sensor data can communicate centralized cloud. Okay. Also, the family room, family members also equipped with sensors. Okay. Can use the smart sanitize. Okay. For example, without touching anything, he and she can wash their hands. Family members can use robot without touching any control keyboard. Disinfected phone case, smart laundry also, doormat, voice control smart lock, smart doorbell. Okay, this is smart sanitized. This condition, this data can also communicate to cloud. IoT applications in the local healthcare staff can also access this data through cloud. Okay. Okay, next, home isolation. Okay, some COVID-19 patients have a high risk enough to warrant quarantine, but, but not serious enough to warrant smart hospital care. They should follow self-quarantine protocol. Stay at their home. However, it will be a challenge to other family members to protect themselves in same home environment. In this scenario, it is expected that the patient should easily be monitored by hospital practitioners, family members, and the local state authorities with a different level of authorization requirement. Patients' activities can be monitored through wearable, non-wearable device at the smart home. Non-wearable device can be classified into three categories. Vision-based device, this is camera. Medical device, such as oximeter, scale, and the thermometer. Dense sensing network-based device, door sensor, light sensor, and motion sensors. The patient and family members can use a wearable device, smartwatch, smart mask, and the microphone to monitor their vitals regularly. Multiple sensors, including mask sensors, temperature sensors, heart rate sensors, can be attached to patient body, and other smart health device and smart home IoT device can also be installed in the patient room. Figure 4 will show the room. PJT will be collected from these smart devices, which are Bluetooth, low energy, or Wi-Fi based device. And this data can be shared with healthcare practitioners for data analytics. The PGHD data will be monitored by health practitioners through their private cloud, manufacturer's cloud, for example, iHealth Cloud, Home Automation Cloud. To enable trust across multiple cloud, blockchain technology can be used. Additionally, secure data transmission scheme can also support distributed transmission among multiple clouds, can utilize synchronization zones, including IoT network zone, aggregation zone, mining zone, management zone. These zones can be operated by the delegated proof of nodes mechanism. I think this is the different kind of proof of work algorithm in blockchain. Next, smart sanitize. Let's see the smart sanitizing scenario which use IoT technologies. A user will walk up to the home from driveway, and before he and she even reaches the front door, the door unknocks using the optimized face recognition application on the edge. Then the user will walk inside the home. The user's phone will connect with the home Wi-Fi network and will show the presence of user at home. The smart home will set to the right temperature and turn on smart home device without touching any surface. A user can take off his shoes on smart UV floor, put his keys, phones in the smart UV light box, that sanitize these items. Hands-free automation including Kagenao's handle-free refrigerators, faucets, doors, closets can also be used at home to avoid the spread of virus. Voice control devices such as Amazon Echo, Honeywell Wi-Fi thermostat, hand sanitizer, vocal light can be installed at home. Another futuristic technology that can be useful is air cleaning system that sanitize clothing, footwear, clothing and footwear. This system can be installed in closets and laundry baskets. Similarly, smart vehicles can be sterilized with steam. Okay. Smart supply chain management. COVID-19 pandemic has created many gaps in supply chain management. The emergence of IoT technologies can be deployed to improve this whole system. The use case scenarios, including smart inventory and the smart grocery store, are discussed in this section. So this paper shows how IoT device and technologies can enable efficient supply chain, also help in showing COVID-19's spread around us. Now let's see the supply chain management scenario. Okay. Let's explain smart inventory. Okay, smart inventory. Warehouse incoming inventory. Okay. To each item attach RFID tag. Okay. Use drone and store items using smart packages. Okay. And okay, inventory manager. Okay, can check all the smart packages. Okay. Yeah. All the items in the smart inventory. The centralized cloud computer gathers the data related to smart inventory. Let's move to smart delivery. Smart delivery use smart truck, okay. Delivery robot. Okay. This smart truck delivery robot also connected to centralized cloud. Okay, that means central cloud monitors the smart truck delivery robot. So the smart grocery store. Here is retail worker, customer, where global sensors, smart device, temperature sensors. Okay. Also, customer use smart cart. Okay. Items in the smart cart can be monitored. He can pay. Okay. For the items in the smart cart. Okay, smart service. The RFID sensor monitors, track the items in the service. Okay. Because each item has RFID tag. Okay. Customer also wear mask sense with a sensor. Okay. This okay, data for the smart service is sent to the cloud, centralized cloud. So retail worker can find the state of smart service. And the self-checkout for the items in the smart cart. use also this impacted robot drone. Okay, store manager. Okay, can access to all the data via centralized cloud or directly. Okay. And the smart pickup. Not entering inside the store using smart cars. Okay. Pick up the item via the information through the cloud or delivery robot can deliver the can deliver the items. Okay. Okay. Okay, let's see here one by one. Smart inventory. Previous study show that mostly RFID tag have been used to identify the storage of goods in smart inventory. The inventories are facing an unprecedented challenge in coping with the fallout from COVID-19. However, a smart inventory system can provide a safe and secure environment for the workers using technologies. Within inventories, drones can be used to track all the employees to check their temperature using their thermal sensors. Also measure their social distancing using algorithm 2. Inventory manager can also provide UWLT-based wearable device that are less susceptible to interference than Bluetooth device. And workers' health generated data will be stored in gateway to server. If an employee is infected with the coronavirus, then the inventory manager can get notifications through data-driven IoT applications, given proper authorizations and the privacy are enabled. In addition, disinfectant spray can be attached to the servers that can start spraying when the associated sensor senses the sound of sneezing. An intelligent drone can monitor inventory in real time and send alert in case there is a shortage. Yeah. Stereo vision, monocular vision, ultrasonic, infrared, time of flight, LiDAR sensors are being used to detect, avoid obstacles. obstacle is the items that cannot be monitored, solved. The disconnected item. Sensor fusion can be used for obstacle detection when data from different sensors are combined to compute useful information that could not be determined by just one sensor alone. Smart inventory will use RFID sensors and AI-assisted drone to track the items. An RFID antenna AI camera will scan the number of units on the sales floor and will send an alert to store manager in case of shortage. The generated data will allow to automate product orders, also identify popularity of a certain item. The popularity of a certain item means the item users buy a certain item frequently, then the item must supply new items based on the data. Okay, smart grocery store. Okay, IoT along with the AI technologies can help slow spread of infection by enforcing prevention and detection mechanisms through connected sensors in the smart grocery store. Chinese technology firm Kongqing Technologies has developed a smart helmet attached with thermal sensors, which is used to take a body temperature at the retail store. Similarly, thermal cameras, microphone sensors can be installed at the store, which can detect people who are coughing in store during shopping. The customer can wear an RFID tag or smart bracelet at the store. Wear RFID tag, which can be provided by state government during COVID-19 testing. The customer can scan the tag and bracelet at the entrance of a grocery store, which allows her to enter based on her health condition. From a customer's perspective, the user can enable alerts on his smartphone regarding his grocery list, can see the map of the store, crowded aisles, and plan accordingly to maintain social distancing while shopping. The customer can visit the desired aisles and will get items from the smart servers that will put items in the smart cart without contact. Smart shelves will have three common elements: RFID tag, RFID reader, and antenna. The customer-generated data will be collected by smart shelves. Smart cart. During the day, this data will be analyzed on the retail cloud. Social distancing can be measured and enforced by AI-assisted autonomous retail robots as well, who can alert the customers through a speaker. UVD robot can also use ultraviolet light to trap infection virus and sanitize surface. Nowadays, most grocery stores provide contactless drive-through pickup for all customers and deliveries at their doors. However, some users, such as elderly people, may not be familiar with such online option. For them, grocery store can provide a smart robot delivery. Smart pickup outside the store also provide a separate parking area to avoid long waiting line. A restaurant take-out service can follow the same protocol for smart pickup. Intelligent transportation system can support in delivering resources to users. The author for this paper, Gupta, have elaborated how ITS smart city infrastructure can be used to enable enforce social distancing community measures in COVID-19 outbreak. Okay, let's move to smart locality. Smart locality is deal with the life of local community. Okay. Smart localities consist of various interdependent human and physical systems where Internet of Things represent the sensing and the actuating infrastructure to estimate the state of human and the physical systems. Also, assistant in adapting changing these systems. They discuss two scenarios which can help humans to adapt to a new normal in COVID-19 situation. These two scenarios are shown in figure 6. Okay, figure 6 shows the connected future smart locality, local community. Let's see. There is a smart nurse home. Okay. COVID-19 patient is here with several sensors. When the wear mask sensor, okay, glove sensor, RFID sensor. Okay. The local cloud gathering this data, and the nursing home practitioner, okay, can access these data. In local community, smart child care, this is teacher. Okay. Equipped with the temperature sensor, microphone, mask sensor. Okay. Care children. So this data also sent to the locality cloud. Smart gym. The exercise they also wear sensors. Okay. Also, gym also is self deploy local motion sensor. Okay. Also, local cloud gather these data. Okay. Also, smart neighborhood. Okay. Also, the person who ride the bicycle also wear motion sensor. Okay. Smart home, same. Okay. The local cloud also gather data from smart neighborhood. Okay. Also, there is a smart restaurant takeout service. COVID-19 patient stay in smart car, and in the smart car, the patient can buy food using the restaurant used delivery robot. To sell the food to the COVID-19 patient in smart car. Also, these data can be sent to local cloud. This is the example of connected future smart locality. Okay, smart neighborhood. Every individual who lives in smart neighborhood will receive a notification regarding allotted time for outside activities. Interesting. This is allotted time for outside individual activities, such as riding bike or walk on the trail. In order to maintain social distancing while being outside in common areas. That means they adjust the number of persons. Yeah. Playing in the ground together. So this is kind of social distancing. Okay. In a smart neighborhood, motion sensors, cameras will sense the presence of people, will send the counting numbers to locality cloud. Cloud Smart Analytics service can analyze the locality data and will send the notification to user. IoT applications can suggest different paths for each individual using motion sensors and travels sync algorithms so that people can avoid meeting impacted people without denying his own her identity. There will be disinfected sprinkler installed that can spray on the pedestrian paths and the community park. And sensors will sense the presence of an infected person in the area through notification from locality cloud. Yeah, it's interesting. Now, smart child care and nursing home. United States CDC have issued the guideline not to safely open child care and schools in the locality. The child care can use RFID tag.
알겠습니다. 웹에서 캐뉴스에 대해 찾은 결과입니다. 확인해 보세요.
Motion sensors, door sensors, smart device for children's safety. The sensors can be attached to kids' clothes to monitor their sleep patterns, breathing patterns, body temperature, body position, And this data can only be stored on edge server for child security purpose, while step teacher generated data can store on locality cloud. AI-assisted camera can be installed in child care rooms to measure social distancing among children and teachers. However, it is challenging undertaking to maintain physical distancing in child care. In such scenario, sensor-based partitions of each room will allow a gap among the kids, and it will allow only one or two kids in each partitioned area to maintain distance among them. Teacher and staff will receive a notification to change their gloves and masks through attached sensors on gloves and masks. In a smart nursing home, if an elderly person shows symptoms of COVID-19, the person should be treated in an isolated room immediately. Autonomous robots can be utilized to help in disinfecting common areas. Elderly health generated data and their clinical reports can be accessed through applications and will store in locality cloud. The care coordinator should have access to locality cloud to monitor each elder regularly. Similarly, a smart gym would include motion sensors, door sensors, humidity sensor, temperature control sensors, and AI-assisted cameras. The generated data will be stored in locality cloud, will be analyzed by cloud service. Gym manager can only access the analyzed information anonymously, so that he can assign a particular time to maintain the 25% occupancy and the time interval to sanitize all gym equipment and surface. To enable multi-cloud secure data and information sharing and the communications between local clouds, there is a need to build a decentralized trust framework in place of using advanced technologies like blockchain and trusted distributed computing. Daegu, the South Korea, the third largest city in South Korea. This city is far from Seoul. It takes, I think, 4 hours if we take a bus. Okay, 2 hours if we take high-speed train. Okay, Daegu has set up a novel system using a large amount of data gathered from various sensors and devices, such as surveillance camera footage and the credit card transactions of confirmed coronavirus patients to recreate their movements. The Newcastle University of Urban Observatory developed a way of tracking pedestrian, car parks, traffic movement to understand how social distancing is being followed in thin and where. However, other major cities need to prepare themselves for coronavirus future outbreak waves. Smart cities can host a rich array of technological products that can assist in early detection of coronavirus outbreaks through IoT sensors and mitigate infection through social distancing and the mandatory masks policy. Connected sensors and data sharing through cloud IoT architectures can be utilized to enforce social distancing measures around a smart city. They discuss various scenarios including smart tracking, autonomous test vehicles for smart city. Okay, let's see the smart city overview. Okay, first the smart tracking of impacted area. City Cloud always track the impacted areas. Okay. Also, City Clouds get the data from autonomous vehicle testing. Okay. Smart office, same. Local health step, okay, can using IoT applications, okay, can find the impacted area, keep track, keep ongoing tracking the impacted area. Also, the testing results. Okay. The mass quarantine. Okay, here patient this data can be gathered. Okay. Smart tracking. A patient who is out of house or out of quarantine area can be monitored. Okay. Also, COVID-19 patient in the car can be monitored. Okay. This shows how the smart city handle COVID-19 patient. Okay. Now let's see smart tracking. Most of countries use the phone data to track citizens' movement during pandemic. Yeah, so you move to anywhere, your phone application, for example, Google and Facebook always track your location. Same as the cellular company also can track your location and your movement. Okay. So most countries use the phone data to track citizens' movement. In addition, urban cities deploy the connected drones and law enforcement, which can to track restrict movement of individuals in a smart city without evading citizens' privacy. A smart city can be characterized by a smart infrastructures that will be optimized for performance to mitigate the coronavirus outbreak and saving lives of citizens. Smart infrastructures need to follow the protocols defined by federal and state agencies. Okay. Some cities has been using drones controlled by police to enforce the lockdown and circulate information, announce message. Please respect the safety distance attached with loudspeakers. The unmanned aerial vehicles also sprayed disinfectant at Chong'an village amid an outbreak of new coronavirus in Handan, Hebei province, China, Savannah City. Announced plans to use drones to enforce social distancing among residents. In a smart city, AI-assisted drones are being used to measure 6 feet distancing among people using distance measurement sensor, the monostereo. The distance measurement sensors are divided into multiple categories. However, Mono stereo is less costly, accurate, fast, high resolution. AI-assisted drones can also identify those people who don't follow the protocol. For example, users not wearing a mask may receive $500 fine. In smart cities, multiple drones monitor citizens to avoid collision obstacle avoidance algorithm. These drones train their models on edge using federated learning process before sharing its training data with an edge or city cloud. Each drone can monitor its area based on individual experience. However, a gate value of parameters from nearby urban area is collected at the edge computing side for collective decision making. Corona-19 test results of a patient can be stored on City Cloud, which can be shared with local state staff, healthcare providers. Most dominant cloud service providers use their own default data placement strategy to make storage computing of data. Furthermore, QR code can help the citizen using geographic data to know about risk zones in the city. Okay. Yes. Let's move to autonomous testing vehicle. Yeah. In order to keep patients and healthcare providers safe, driving through coronavirus testing sites have been popping up in the city. Autonomous testing vehicle can be used for coronavirus 19 testing in urban city, as well as rural area. Multiple sensors, including infrared body temperature sensors, oxygen level sensor, AI-assisted camera, microphone, will be installed onto the vehicle, which will also carry testing kits. This autonomous vehicle can help reduce exposure of elderly and pre-existing condition people to COVID-19. A person will get notification of autonomous vehicle's arrival, then the person can enter from one side of the grass world area in the car. Inbuilt sensors can record a person's body temperature, oxygen level, and can store this data on local edge device. The generated health data will be stored on local edge storage, and these sensors will also publish the data on City Cloud to share with the healthcare practitioners. It can also provide a test kit to individuals who can test themselves and return it through the car window. In rural area, autonomous testing vehicle can bring awareness of COVID-19, improve accessibility to testing, and can even provide free testing to underprivileged communities. To flatten the curve of confirmed case, to avoid the rapid increase of confirmed case. Smart city can provide mass quarantine for coronavirus patients who have mild symptoms but are higher risk individuals for spreading cross-infection to others. A small hall or large stadium or facilities can be set up for quarantine with installed sensor, smart device, robots that are connected to cloud. This infectant robot is an autonomous robot that can sterilize floors in these large areas as discussed in other scenarios. Large-scale disinfectant robot can also be used to clean the road of the city. Autonomous and self-driving vehicles can be used for delivering the post, which will also help to reduce the human contact, cutting down the number of COVID-19 cases. Smart city can also provide immunity-based RFID tags to those people who recover from the disease and can allow the tag holders to return to work with extra precautions in the future. Once COVID-19 vaccines are available, actually now the COVID-19 vaccines are available now, the individuals with the vaccination can get similar immunity-based RFID tags to provide their immunity. In another context, autonomous vehicles have been extensively investigated in the research. Okay, yeah, you are involved to explain the summarize the following three figures. But first, the Atul is responsible for summarize and explain figure 8. Abanit Singh is responsible for figure 9. Ronel responsible for prepare the summary of figure 10. Okay, each document, the size is above 2 pages. Okay. Okay, figure 8 shows the general implementation framework for smart communities utilizing AWS IoT and cloud service. Okay, figure 9 related to setup of remote patient monitoring in smart home. Okay, figure 10 shows the sequential view of remote patient monitoring in smart home.